Hi everyone, thanks again for joining us today for our webinar on our Rethinking Your Healthcare App Strategy with Blueprints 2.0. We're excited to talk with you through some of these things today. Just to give you a few housekeeping items before we get started, we will be recording today's webinar, so if you missed part of it and want to go back and review it, or if you had a colleague that wasn't able to make it, we'll make sure we get a link out to you where you can either review or share that recording. There's also, we'll be saving some time at the end for questions, but if you have questions as we go through, I think some of you have even already posted a few, there's a question box on the right side of your screen under your GoToWebinar control panel. Please feel free to go ahead and post those as you think of them. I know if you're like me, you'll forget it as soon as you move on, so we want to make sure we get those questions answered, and if we don't have time to get to them all in the webinar, we'll make sure we have someone follow up with you. So with that, I'm going to introduce our speaker for today. We have Dave Sawin. He is our VP of Product and Marketing, and he's going to be talking to us today.
Thank you, everybody, for joining. I appreciate it. I hope we've got a big group. I see quite a number of people have joined, and I'm hoping you are all healthcare change agents, because what we're going to talk about today is how healthcare is changing. We're going to talk about the effect of consumerism on healthcare. We're going to talk about technology trends, and we're going to talk about how millennials, as the largest demographic currently alive, is really disrupting the healthcare system. And then we'll review what we're bringing to market, and we're actually, announcing our new Blueprints 2.0. And you might not know what a blueprint is now, but by the end of the talk today, you will definitely know what we're talking about. So let me get started, as I said, talking about disruptors in healthcare. So right now we're going through what is possibly the biggest disruption in the way healthcare is administered today. When you look back 5 or even 10 years from now, you're going to see a completely different delivery model of healthcare in America. It hasn't changed a whole lot, too much since I was first getting into the healthcare market, having my first children. That's often when you first engage the healthcare market for the first, or the healthcare system for the first time as an adult, is when you're having children. And it really hasn't changed that much since then. Maybe I don't have to worry about pre-existing conditions anymore. That's probably the biggest thing that I think about. But the disruption is coming, and one of the reasons is because of, as I mentioned, the demographics. Millennials are the ones that are really getting into the healthcare, and they think differently about health. Also, competition. It's coming from all different directions. There's many non-traditional healthcare providers now getting into the space. And then finally, technology. Obviously, I think Sheryl Sandberg, she's all on everyone's mind with Facebook these days. Sheryl Sandberg, the COO of Facebook, said that the adoption of mobile technology is the fastest technology adoption trend since the beginning of humankind. That the iPhone came out 10 years ago, and it's dramatically changed the way we live our lives in that short 10 years, unlike any other technological revolution. Automation, manufacturing, even the internet didn't change our lives as quickly as mobile phones did. So we're going to talk about these things. I'm going to get started first by talking about millennials. So here's the millennial impact, and the statistic I want you to keep in mind here is that the lifetime value of a new person joining your healthcare system is $600,000. So keep that in mind. Then think about what you're seeing on this page, and that is just in the last 4 years, millennial spending power has tripled. It is now the greatest spending power in 2018 of any generation at $3.39 trillion. It's been the largest generation in history now, because remember, these are the children of the baby boomers, which was the largest generation before that. And now they are taking command. By 2020, millennials will be making the majority of the healthcare decisions, because it'll be their own healthcare, their children's healthcare, and then in many cases, they're the caretakers of their adults or others as well. They're a very caring generation. 2025, 75% of the workforce, that means 75% of the company health programs, insurance policies will all be driven by millennials. So the issue that we see here is millennials think differently about their health care. So for example, what you'll see here is I'm going to talk a little bit about the concept of convenient care. So I grew up in a time when I had a primary care physician. I was required to nominate one because of my health plan when I first started working at IBM. That's the healthcare quarterback. He's the quarterback of my healthcare team. he or she told me to do something and I would do it. You need to see this specialist, you go see that specialist. I couldn't see the specialist without their permission. Millennials don't really do it that way. They're seeking convenient care options when they get sick, but they don't necessarily, what was that statistic? What percentage of millennials don't have a primary care physician?
Oh, I believe it's 87%.
Right, do not have not nominated a primary care physician. So they're using their apps on their phone as their advisor on what to do next. They think of their health in terms of, like I think of my health in terms of losing weight and not getting sick. And millennials think of their healthcare in terms, or their health in terms of doing healthy activities, and not really, when they get sick, they're gonna go to one of these convenient care, like a retail clinic or an acute care clinic, a minute clinic, that type of thing. And you can see over 50%, that's their first line of defense, is one of these convenient care clinics. Then you see that even my generation, I'm a Gen Xer, and millennials, they'll switch providers for something as simple as the ability to book online. So again, digital technology is driving where they are going. The second disruption I'll talk about is competition intensifying with consolidation and transformation. That's a lot to say in one sentence, but the point is, you see here, CVS acquiring Aetna. What was the one, was in the news today? Optum. OptumRx is starting to drive, using their power with the consumer base. They're starting to drive people to their own provider networks. And so I'll try and pull that one up and send it around. But Optum is basically a prescription company, and now they're going to start driving people to their own providers, which charge 20 to 30% less than regular provider networks. So you see these things happening. And in fact, you've got in this slide, what you see circled is 10 of 53. So there were 53 of these healthcare mergers last year, many of which were non-traditional players coming in. And what is it that they're trying to do? They're trying to change the healthcare model. So on the left side, you can see where competition is what's needed to change the healthcare system. So you're not rewarding volume, you're not rewarding readmissions, right? Because it's fee for service. You're paying for value. You're creating choices for patients. So this looks like what any consumer organization will be doing for their customers, and that is now coming to healthcare. And what this comes together in the middle of the chart to show, the middle of the slide to show, this is what these generations are expecting. This is what millennials are expecting. Frankly, Gen Xers is this consumer grade experience on their phone to get their health care. Now, another disruption is technology. My dad always told me when I was a kid to follow the money. Right now, following the money means following the EMR record. It's been a key barrier to competition. When I was younger, I didn't change healthcare systems because I'd have to go find some small hole-in-the-wall office at the hospital to request my medical records to be Xeroxed and sent to me, and it would cost me $35. Then I would take those healthcare records to the next healthcare system after I got them in the mail 2 or 3 weeks later. I would present them to the new healthcare system, and they would say, well, we have to redo all those tests anyway because we don't accept the healthcare records from your prior system. So the lack of portability of patient records was a key barrier to competition. Now what we're seeing is Amazon, consumer company, working with Cerner on a population health platform, or Apple, another consumer company. They're going to let you keep your medical records on your phone. So you're going to have full transportability of your healthcare records via the phone that you have in your hand. So this is really going to knock down the barriers to competition that you see because of patient records. Now, how about this one? Another disruptor. This was our friends at Becker's. Many of you probably downloaded our white paper on Becker's, and that's why you're here today. But this was the most clicked on article. Their analysis of this announcement was the most clicked on article last quarter on Becker's Healthcare. This is very intriguing. So now you've got 3 of the top, real movers and shakers on the planet coming together and said, well, we're not going to wait around for the U.S. government to change American healthcare. We're just going to do it ourselves. We're going to pool our resources that Morgan Chase, Berkshire Hathaway, and Amazon.com have. Their bulk buying power, all their company. I mean, how many people work for a Berkshire Hathaway company?
Oh, I believe it's over 2 million just
Right.
for Berkshire Hathaway.
Yeah, and then you got Amazon and so forth. So they're going to use the technology. They understand the millennial generation. Actually, Morgan Chase had a white paper 10 years ago about millennials in the financial sector. So they've been on this message for quite some time. I actually took some of their statistics for our white paper that Rebecca wrote recently. We looked at their white paper from 10 years ago. So they're on top of these trends, and they're going to be a force to reckon with. This is one of my favorite quotes of the year is, the ballooning costs of healthcare act as a hungry tapeworm on the American economy. So people aren't going to stand for this much longer. So now, this all sounds like stuff in the future, right? What do I have to do about this today? Well, here's the bottom line effect today that's been demonstrated via medical research of how mobile apps can actually improve your bottom line now. So if you're not a change agent and you really don't care about improving the bottom line or making patient experience better, then you can hang up the phone now, you can disconnect, because the rest of the presentation is only about people who are seriously wanting to take charge and actually help us change healthcare one app at a time. So here you see 91% of people in this one study, and I've got all the references in the back that we'll distribute so you can look up these articles. 91% of chronic disease patients said they need help managing their conditions effectively. Another study said that apps have shown to have a positive impact on patient self-management and can aid in behavior modification. So again, a mobile app, everyone has a phone in their hands. Even people who are less well off in our society, that often are clogging up the healthcare system. Sometimes they also have apps, and you can phones and apps, and you can work with them this way as well. So everyone has a phone. Like 98.7% of people have a smartphone now. 75% of adults are non-adherent. Users of health apps are found to be more adherent. 17 billion in avoidable readmissions. Apps help reduce readmission rates. 150 billion on missed appointments. Improved wayfinding, as well as other appointment reminder technology in apps help get patients to their appointments on time. So you can see the bottom line impact is actually here today. And that's because, as I said, people are spending billions of hours on their phone. And I mean, sometimes you feel like your phone is closer to you than your spouse. You trust your phone more. Some people would say that. I wouldn't say that, or at least I wouldn't say that publicly. But it really has become like your second brain. That phone is your second brain. Now, a lot of people, a lot of clients that we talk to say, that we've got this covered. We have a mobile web strategy. So our web team has worked really hard on making responsive websites so that you can get to our website from your phone and we're cool. Well, the problem is people spend 87% of their time on their phone in apps. And it's apps that send those reminders to the screen that people look at 250 times a day. So that home screen, those reminder messages that you can send from an app, you really can't send those from a mobile website. You can't get a list of locations that's sorted by distance and wait time very effectively from a website. You can't really do wayfinding very effectively from a website. So there's lots of things that have to do with the apps and what they can access on the phone in terms of location-based services, in terms of notification services, profile information that you really can't do from a website. So you really need to have an app. A mobile web is not going to do the trick. So here, this is what we do. MobileSmith, we're changing healthcare one app at a time. We're going to show you these Blueprint 2.0 offerings. We're announcing this today that we have launched the blueprints a year ago. These are proven use cases and apps that you can deploy completely customized to your protocols, but they're pre-integrated functionality. And we have had rapid adoption from our customers. We've been publishing case studies based on the year one results. And now we've taken all those improvement points and re-released them as the 2.0 version. So no one wants to do the 1.0 version, right, of technology. You want to wait for that 2.0 version, and it's here today. So what are our blueprints about? Well, our motto is to think big, start small, and act fast. And what that means is when you get into a committee talking about rolling out a wayfinding app or a hospital access app or a pregnancy app, no doubt many people in the healthcare system come up with lots of really good ideas. They're going to take years to implement. But what we can do is take that first year roadmap of what you could do and accelerate that to 3 months. And we have all those functions already ready to go. They're intuitive, easy to use. They've been honed. Here's a great statistic. What was it? Is it 55% of apps in the App Store? Was that the?
55% didn't have a medical professional involved in creating the app, and only 24% of those apps actually reported using evidence-based practices in their content and their directives and that sort of thing.
Exactly. Yeah. So that's pretty scary. 55% of the health apps in the App Store had no medical professional engaged with them. 100% of our blueprints have been through multiple committees at multiple customers, and that's why you can trust them to deploy them rapidly. So I'm going to take you through a little patient journey, and this is how the blueprint. I'm going to really highlight how our Blueprints 2.0 platform works together in our products. And what it starts is I'm going to be this person on the beach, and I have injured my knee playing tennis maybe a couple of weeks ago, and it's just been bugging me. And today on the beach, I was kind of running and digging into the sand and just really started to hurt. And I'm like, something's not right. This just isn't healing. So I do a quick search on my phone. I'm not near a computer, right? And I do a search on my phone and I say start looking things up. And I find actually my local Graywind Hospital has an app I can download, and it says, hey, why don't you do some self-triage? Why don't you check your symptoms and see what's going on? So I download this app. And I get a quick little symptom checker, and it asks me a few questions, and then it says, sure enough, based on the answers to your question, you need to go to an urgent care. So I see which urgent cares are close to me, which ones have the shortest wait times. I'm off for the day anyway, so I'm like, I'm going to just go ahead and take care of this. I'm going to miss the second half of the day at the beach, but I'm just going to go ahead and get in there. So it says, check me in. This is great. It's a 10-minute wait. And now I have a 15-minute wait. I'm the third person in line, and I've got a visitor ID that I can actually punch into a kiosk when I get to the urgent care. Now, I go to that appointment, and they say, listen, you need to go see a specialist. So they get me registered with a specialist, and on the day of that appointment, you can see here I can pull up that appointment on the same app. And I can get directions to that facility, and then also inside the facility I can get the first place I need to go to is anesthesia for this procedure, so I'm going to be able to go to that clinic directly just using the app. So I go through, and here I am. They're checking my knee out. They tell me finally, the specialist says after doing a number of tests, it's like, yes, you've got a partially torn ACL, and so you really need to have surgery. So that and unfortunately, this is what you're going to have to do. So what they do is they point my phone at a QR code in the exam room, and I download my surgery app, and they've scheduled me for that surgery. And now they say, look, you need to go through and check out this pre-op checklist. Make sure you're ready for surgery, and then once the surgery is over, it'll actually walk you through everything after the surgery. So you have both the pre-op, the full perioperative experience around this knee surgery is taken care of in an app. And so you can see I get the surgery, afterwards I follow all the procedures, I do the physical therapy, and sure enough, I get, I recover very quickly. I actually recover better than somebody, there's a study that shows I will recover better than somebody who did not have the app, reminding them to do the physical therapy and so forth. Not only that, but we just published a study that this sort of perioperative app can save up to $372 per procedure in terms of missing appointments that ultimately don't get rescheduled, in terms of preventable readmissions and the cost of those, same-day cancellations and so forth. So this app has not only real patient experience value, but it also and efficacy, but it also has business impact. So now as the patient, I don't know all that, right? I'm the patient. I don't really care about those numbers. But about 6 months later, I'm fully recovered, and my wife says, guess what? We're going to have another child. And I'm like, this is so exciting. So I open up the app and I start browsing around, and I find out, in fact, yes, there's a pregnancy app I can also get from Graywin Hospital. I download that. I learn about that. I put in my my wife's due date, and in fact, this is also going to remind us about different classes we can join, how we can get into the full experience. And again, this isn't from the main app. This is a specialized app just for this pregnancy that's going to give you that totally immersive experience. So what I showed you, I'm going to take you through this in a little bit more detail. What I showed you was our Blueprint 2.0, what we call the Hospital Access app. And it includes some key functions, but it includes patient portal. So this is the ability to access appointment information. Symptom Checker, so you can do that self-triage. It's a medically validated symptom checker that we partner with one of the leading symptom checking companies, Isabel. It has Wayfinding. Again, we partner with the leading indoor positioning and indoor intelligence companies to bring this to market. JiveStream does our mapping, for example, if you've ever talked to them. And then, of course, wait times. We've got a couple of different wait time partners that we work with. A lot of times our clients already have a wait time system, and it's just a matter of queuing, wait time, and check-in system. It's a matter of just doing that integration, but we can also bring one. And what we've seen is using apps like this, we see huge dramatic increases in patient experience, HCAP scores, and that benefits your bottom line, right? 2.6 times more profitable if you have 75th percentile HCAP scores as compared to like 25th percentile HCAP scores. So high patient experience versus low patient experience, 2.6 times more profitable. And so this is a logical first step. Why is it? Because these statistics here, smartphone users want to get information about their health condition, 62%. They want to use their smartphone to communicate with their healthcare system and get information and education. And as we mentioned before, they want to book those appointments online. 71% of millennials want to do that and manage their preventative care using an app. Now, the next feature we talked about a little bit is the Symptom Checker. Now, this is really the thing that I always think about when you have an app. We know that people delete apps, so they use an app, they download it. We saw a study a couple years ago that of the first round of hospital apps like this that came out several years ago, only about 2% of them ever got used because they didn't have any functions. They just were like a glorified website. This is a function that people will come back to. It's sticky. People will want to go, oh yeah, it has a symptom checker. Let me go back and check this symptom now. Let me check that symptom. And so this is actually a way to onboard people into your healthcare system as well as keep the app on the phone. This is probably the primary feature that you will come back to is I can put some symptoms and it tells me if I should, or it suggests what type of care I should seek. And it comes from a medically sound source. So you think about this in terms, again, the lifetime value of that patient. You don't want them deleting the app. You want them to be continuously coming back to you for their healthcare decisions. Then we talk about the wayfinding, the GPS obviously built in where you can get directions via, your native platform, Apple Maps or Google Maps, get to the facility. But what about when you get to the facility? Where do I park? What are the points of interest? Can I get some location-based messaging? So for example, this can be used not only for wayfinding, but can also be used for patient experience. Give them a little HCAP pre-score as they're leaving the facility. You geo-fence your facility as they're leaving, you pop a little message saying, hey, why don't you take this 10-question survey real quick? And you can spot people who are having difficulties or had difficulties, before it becomes a bigger problem and before they actually fill out the 25-question HCAP survey later down the road. So having said that, poor wayfinding has a real bottom line impact. This is just one of many statistics. Patient experience aside, just looking at staff hours, working with your patients to do unnecessary wayfinding. Obviously, you want to help people in your hospital. That's what healthcare people do. They want to stop and help you, but unnecessary wayfinding, things that people could do on their own, is wasting $220,000 a year. Patient portal, again, this is to improve the care transitions. You can check your lab results, appointments, medications, health history. And again, a key factor in preventable readmissions, it says here, based on this study, is that inadequate health literacy that you get when you're not aware of your health history, for example. Then finally, we'll talk about the wait time. So again, for 80% of patients, being told wait time in advance would completely or somewhat eliminate frustration. So what's the opposite of satisfaction? It's frustration. So if you want to increase your satisfaction scores, your HCAHPS scores, you have to do that by eliminating frustration. So when you eliminate frustration, when you just give people an accurate time frame of when they're going to be seen. Now you get bonus points when they can check in remotely, right? I can say, hey, I'm checking in remotely. I've checked into my appointment. It says that I have a 25-minute wait, so I can actually stop by and grab something at a convenience store on the way, or I can do a quick errand. So people can go on living their lives without necessarily having to wait unnecessarily. So,
well, and so often the wait time is less about the actual time you're waiting than the perception, because if you don't have that time context, people tend to feel like, it's repeatedly people report that they've waited for almost double the time they actually have when they don't know what that time frame looks like.
Exactly, yeah. Humans are just terrible at time estimation. And like when you're frustrated, time goes very slowly. When you're engaged in doing something, time goes very quickly. That's why probably a lot of people get into healthcare as a profession, is the days just go by so quickly, it's so busy. But having said that, now the next thing that I showed you in that day in the life activity, I showed you the perioperative, but also the pregnancy app, and we say this is the millennial must-have. So 82% of children born right now are to millennials. They're not going to be using books or booklets very much. They want an engaging app. They want an app that gives them features like this. And these are just some of our clients that have done apps. I want to show you, these are what we mean by blueprints. So I spent a little bit of time, I promised what I mean by a blueprint, and that is we have all of these functions that are ready to go: illustrated milestones, interactive tools, appointments, services and key contacts, visual trackers, tips and to-dos, things like if you look at the trackers, are you drinking enough water? You don't want to get dehydrated when you're pregnant. Do you have a packing list for when the time comes so you can get to the hospital quickly? But all of our clients, they look completely different. So it's not like a blueprint means you make it your own. It's ready to go. You can deploy it in 3 months. It doesn't mean that you're stuck with some boring template. It means you can completely design your own function, and you can even put in your own protocol. So we have this feature here called Milestones that we load in for you that does a week by week, what's going on. You can load your own content there. You can load your own classes. On week 13, you should be thinking about going to this class. So you can do whatever you want to do with the app. So just kind of going through, we have had great success increasing some of the different subscales of the HCAHPS score, working with our clients with this pregnancy app. These are some of the lesser thought about things that you might put into your website, but just nutrition and personal care. There's one that we're working on, has to do with understanding medication, for example. So the last thing, when a mother's just given birth to a child, and you've got a lactation consultant coming, you've got someone talking about the care and cleaning of the umbilical cord area, you've got someone coming in and teaching you how to change diapers, you got all these specialists coming one after the other. The last thing you're going to pay attention to is you need to understand what medication you're taking and how that's going to impact the baby necessarily. So that's one where there's often low scores, HCAHPS scores on understanding medications. And so you can actually prompt them to study and learn about the medications before they give birth, for example. So that's just a key example of how this regimen of milestones will raise your HCAHPS scores. Another thing, again, I showed this to you earlier, is just messaging alerts. So just being able to say, hey, there's some classes you might want to be aware of. There are some information, some things have been going on at the hospital since the last time you were there. The last thing you want to do is surprise someone when they're on the way to the big day. So you can send them updates and information. So just to kind of bring things to a close, I know we're over by a couple of minutes from what we said, so we try and keep it to 30 minutes, is our blueprint catalog. So really what you think about is you've got this hospital access app that I talked about. You've got the service line apps. Pregnancy is one of them. Bariatrics is another popular one. The ER urgent care app is a popular one that you can do, as well as your heart center is a service line that needs an app, for example. Then you've got the perioperative apps. I showed you the knee surgery one, but you can think of just about any procedure you want to increase your scores and reduce your costs. You make maybe take your top 10 procedures. Actually, we have one client that's producing what they're calling the general surgery app. So basically, what are the 20 common things pre-op and post-op to all major surgeries? And they're providing that single app as the first one for perioperative care. And you're going to see a lot of those same benefits, for example. And then condition trackers, obviously population health, these chronic conditions as well. But really what we're trying to focus on today is the hospital access app and then the pregnancy app as sort of we call it our Millennial starter pack. And so we'll have some folks reaching out to you if they haven't already to tell you a little bit about the Millennial starter pack, and we'll have some great pricing and promotions on this 2-app package for the rest of this month based on our big announcement of the Blueprints 2.0. So at this time, I'll take some questions. Before that, I'm gonna this will be recorded, and you may come back to this later, and you might want to say, what were all those references that Dave was talking about? I just want to make sure I flash this on the screen for 30 seconds or so you can do a screen capture if you want to look these up. Or if someone calls you after this, you can request the references from them as well. But with that, I'll go ahead and open the floor for any questions that we have.
Thank you so much, Dave. We do have a few questions, and like Dave said, we know we're over by a few minutes, so if you have to drop off, we'll certainly follow up directly as well. But I'll combine a few of them into kind of one question. If you can talk a little bit, Dave, about what the process looks like for creating one of these apps, how that plays into the MobileSmith structure, and then maybe as a follow-up, address how it would differ from doing a native mobile app like this to you kind of talked about the difference between responsive web. If you can talk a little bit about maybe how it even differs from, say, a progressive web app, right. That sort of thing.
Well, the first part is the onboarding. We have a very specific onboarding experience we've honed over the last couple of years. Our client success team will have an initial call, maybe 15, 30 minutes, just to introduce everybody and walk through what that process is. And then we'll just follow that process based on the schedule you want to follow. We're very sensitive to internal reviews that need to occur, and we'll basically map out starting with showing you all the different. Let's say you're going to do a pregnancy app. We'll show you all the different pregnancy apps we've done to give you a real flavor of what you can do. List of all the different features that we recommend. We even have analytics that say which are the most popular features. So if you're wanting to help design the user experience around the ones that people use the most based on our analytics. So we'll map that out, and then it's real simple from there. We do all the work, and you guys provide the level of content that you want to provide. So a lot of our clients want to provide very specific content that they've already have. Some clients say, here's our existing booklet that we hand out to all our patients, please turn it into an app for us. And so it's already approved content, but they just need an expert that understands mobile to make that, taking the pages of information and turning it into little info bites, the 240 character, info bites that people have come to know and love. And so, and then we will work on providing storyboards, so you can review all the storyboards and approve them, and then we'll make the app and we'll release it. Now, the second part of the question had to do with the comparison of what that would mean in terms of like responsive website.
And also like progressive web apps, where you kind of get that hybrid model, and how a native app built on our platform could really benefit. Right, absolutely.
So first of all, we are a platform that allows all of the above. So if the fastest way to get something done, let's say for your patient portal, for example, if you don't want to take the time to do some integration, and you have a nice mobile responsive web login to your patient portal, we can just put that in the app. So if you click on patient portal, it takes them to what looks like something that's inside the app. It's really a responsive website, and they can go log into that. And that allows you to kind of move fast. So we can sort of ingest mobile web pages and make that part of the experience. But some of the things that I showed you in terms of like the wayfinding mapping, the blue dot turn-by-turn directions. I'll show you another one here is I'll go back to the proximity sorted wait times that you can click on this list of proximity sorted wait times and then get in real time a check-in experience. Let me find that one. Like here, this type of thing is very difficult to do on a mobile website. You're just not going to get the same kind of experience. You're not going to be able to get particularly the proximity sorted based on your location features here. Another feature that is really, again, the wayfinding is very, you're not going to get a good wayfinding experience with a web app. These sorts of milestones where you click on these and it takes you quickly to more information, again, difficult to do in that sort of a website. And then these reminders, obviously, having these reminders, not something that you really do from a website. So what we can do is we do the best of both. So where we need to quickly adopt some of your content. So for example, here, driving this list of milestones is native app function, but when you click on the 2 hours after surgery, it might actually pull in data from your responsive website. We could do it that way, for example, just to be good. But I will tell you the final and biggest and most important thing is if you don't have an internet connection, if you're buried deep in the hospital and you don't have that internet connection, you don't have that cell signal, and you have it connected to Wi-Fi, mobile web doesn't work. So, you really want the majority of your functions coded in as a native application.
Great. And then, so kind of keeping on the technology theme, who would be responsible for developing the app? Do they have to have a strong technology background in order to be able to handle, native app sounds kind of intimidating. Who in the hospital would be the person that would be in charge of the app or that would need to be kind of running point on that?
So we got another webinar you should watch, our case study with Luke Popish from South Shore Hospital. He explained it the best when he said he's not a programmer at all. He didn't have to know how to do anything. He actually makes his own apps in the platform. He went to a 3-day certification. And the thing he likes the most is that someone, he's the director of the OBGYN service line at South Shore Hospital. He gets an email from the CEO saying, hey, this phone number's wrong, or hey, I just noticed a typo in the app, or hey, I'd like to reword this to make it more inviting. He can make all those changes himself in 2 seconds using our platform. So you have full control over the content management system. We usually like to build the first app for you. And more so, what we found is our most successful customers are the ones that actually let us do all the app building. And then maybe they just focus on the app maintenance. Not that it's not easy to do. It's just you've got a full-time job. We work with marketing departments. Predominantly we work with service line heads. Like you got a full-time job to do. And you can just let us take care of it for you. So I hope that answered the question.
Yeah, I think so. And I know that we are running a bit over, so we'll go ahead and wrap up here. And if we weren't able to get to your question, like Dave said, we'll make sure we have someone follow up with you to talk through some of the options for getting started at your facility. So with that, I want to thank you all for joining us, and thank Dave for talking us through the blueprints today.
You're very welcome. Thanks, everybody, and I hope you have a wonderful rest of your day.